Hi guys,
Hi.
I'm Dr. Topham.
I'm Mark Anton.
Hi.
So I've been looking over your stuff, and so it's a little confusing. So you're gonna have to help me out a little.
Okay.
Okay.
So what I see is that you have a pancreatic mass that is kind of plugging up the biliary system into the liver, and you have a stent in there now.
Yes.
That's kind of doing all right.
Yep.
And you're on some kind of chemotherapy.
Yep.
But one of your doctors is concerned that you're about your platelets.
Yes.
Yeah.
Dr. Isaac in
He's
California.
the specialist in UCLA.
All right. Now, the most recent platelet count that I have is from July 25th, and that was 112. You have
It
something-
went all the way down to
66.
66, and then he had like a month off because they didn't do treatment because it was so low, and then we went on a little vacation, and then he just started treatment back up again. He had platelet. He gets blood work every Monday. He just had it on Monday, and it was
104.
100. They were at 104 this week,
You
so
don't
they're
have that record
they're
in
back
there?
up
That's
again.
fine. So
We had the recent medical.
That's okay.
Yeah.
104, most recent.
That was last Monday.
Okay. So the procedure they've asked me to do, we go in through the groin. Well, let me just back up a little bit. The spleen, when it gets big, eats up platelets.
Mhm.
The bigger the spleen gets, the more platelets it eats up. So as the platelet count goes down, one way to keep it from going down so much is to take the spleen out. A part of the spleen out, the whole spleen out. Either way.
Removal or?
Well, we'll get there.
Okay, good.
So initially it was done surgically. They'd go in and physically cut it out or cut half of it out. Now we do it from the inside, and basically by going through the groin up into the artery that goes in the spleen, we plug the blood vessels that go to about half of the spleen,
Yes.
killing half of the spleen and shrinking it and functionally removing is the fancy term we use. So it's basically so only half the spleen is working. A couple of side effects. Number one, it hurts. Nothing likes to have its blood supply cut off like that and die. People really complain of bad back pain and side pain for a couple of weeks as that's dying back there. I've seen it form an abscess every once in a while, not usually. Pain is the main problem. Now, in your case, your platelets are a lot higher than anybody I've ever done this for. Patients I've done this for, their platelets have been 10, 20. I don't even think I've seen anybody over 40. So as long as your platelets stay up in this range or above 40, I personally don't see any reason to be doing this.
Okay.
And
Because-
that's what our doctor here said.
Yeah, that's how our doctor here says too. It's just the doctor in California is
We
a
see him once a
pancreatic
month.
specialist, and we see him, about every 6 weeks or so. And I don't know, he kind of threw us for
The last time he seen us, it took a big drop down to
to
66.
66. Within like a few days, it went from 77 to
78.
7 to 66, and so
But they increased my dosage. Dr. Isaac in California increased my dosage to where it was hitting me heavy. And he was giving me the mitomycin also. And
but
the
he hasn't had the mitomycin, and our oncologist here thinks that it's the mitomycin medicine that is knocking the platelets down because he hasn't had it in about almost 8 weeks.
And he's going to give me the
They're going back
mitomycin on Wednesday.
Wednesday.
So what I would suggest is we just keep doing that weekly blood draws and see what they happen. The downside of having low platelets, and they have to get really low. We're talking in the 20 to 30 range. Is that you start bleeding anytime you bump your elbow, you get a big bruise or a big bleed. The head, if you were to bang your head, you could bleed. So you start getting worried in that 20 to 30 range. So if they were to get down to that area, then I would think, okay, it's probably worth the risks of the complications we've talked about, the pain, the abscess, like that, of killing part of the spleen. But as long as you keep them up above 40 or 50.
So Dr. Isaacoff told us that, and we're at the mercy of everybody because we don't know, but he told us that the tumor was against or pressing against the
outflow of the spleen, the splenic vein.
Yeah.
So, if you have, I'm a terrible artist.
That's
so
okay.
This is going to be more of a cartoon.
We like cartoons.
So that's the splenic artery. So here's the aorta. Then the spleen also has a vein that comes back across here and ends up going up into the liver like that. The liver's sitting up here. And the pancreas is right around in here, so your tumor's right around in there.
Yes.
So the blood is going into the spleen. As it comes out of the spleen, it's hitting the tumor, kind of causing a pressure, backing up the pressure, and the spleen responds to that by getting bigger and bigger. And if the spleen gets big enough, then it kills enough platelets, and then the platelets will start to drop. Things that could happen is the chemotherapy you're taking and the other stuff you're doing could make this shrink a little bit. If that shrinks a little bit, then this will have less
And it
pressure.
has been shrinking. The first part they did, I mean, the first one.